Baird, Public Health COVID-19 Operations Chief. Michelle is sitting in for Dr. Richardson today, and of course, Paul Johnson, the city's Emergency Operations Center Director. And as you know, we remain under a province-wide state of emergency and stay-at-home order until at least May the 20th. The situation across our community and, in fact, across Ontario remains serious, with ICUs continuing to fill up and hospitals pausing non-emergency surgeries to preserve ICU space for COVID-19 patients. And I know this is continues to be a difficult time, but we continue to see an increase in COVID-19 cases, including the variants of concern, and these restrictions are required to help reduce the spread of this virus. So please continue to adhere to them. This morning, the GTHA mayors met virtually, and in our discussion, it was impossible not to be moved by the death of Emily Victoria Vega, a 13-year-old from Brampton. She's one of the youngest people to die of COVID-19 in Canada. Emily's death is a tragedy in its own right, but a reminder to all of us that this virus is real and present danger, and we must continue to take it seriously. And as a reminder, under the stay-at-home order, please remain at home except for essential reasons such as going to the grocery store or pharmacy, accessing healthcare services, including getting vaccinated, of course, exercising outdoors safely, and for work that can be done remotely. Individuals are asked to remain in their local communities and avoid all non-essential travel, even within the province, and to stay at home when you're ill, even with mild symptoms. So thank you to everyone who continues to do their part by following our public health measures. You are making a difference. Please visit our hamilton.ca/coronavirus website for a fulsome list of the restrictions that are now under the stay-at-home order and all other matters of benefits related to CERB and all the other positive financial measures that are coming your way, as well as the vaccine and vaccine measures and information on vaccines that can help you make decisions on where to best get and when you're eligible to get. So thank you for all of that. Continue the good work. I'm going to turn it over now to Paul Johnson to lead us in some of the local emergency orders and impacts that are happening in our community. Paul?
Thank you very much, Mr. Mayor. And just picking up with your opening comments, there isn't a lot new to talk about because we remain, as you said, Mr. Mayor, in this provincial and local state of emergency at the stay-at-home order. And so for the next few weeks, things are very much going to be the way they were. Last week, we know we went through a number of things that were closed and dealing with some of the changes that occurred. And now we're going to be in this for a little bit more until deeper into May. And it seems to be having a bit of an impact. Listening very closely to some of the provincial comments and national comments, although we're nowhere near out of the woods, and still, if you're in the hospital system, huge pressures on our hospital system. I participated in a health call today, as I do most days, and it is a very real situation in our hospitals, and there is still all sorts of emergency planning happening and transfers occurring on a daily basis. So nowhere near out of the woods, but what is nice to hear is that maybe, just maybe, we're hitting a bit of that peak, a little bit of that plateau, and then hopefully a drop in cases. And looking at our local numbers, you see just a little of that happening. So it's working. And I want to thank Hamiltonians, as I did just a little bit of traveling to my essential destinations this weekend. As I drove by some parks, much better mask wearing. We still need to ensure that we're wearing masks outdoors when we can't keep that 2-meter physical distancing at any time, and certainly on the playgrounds. That happens often with the nice weather. And you know, we saw a lot of enforcement that we would unfortunately see normally at this time of year. Lots of waterfall related charges, but not a huge number of charges from a COVID-19 perspective. And so that's good to note as well, that people seem to be taking these very seriously. We are, however, getting a few emails in and a few questions about, oh, well, if it's just this activity where people are getting together, surely that's not something you're going to enforce. And just let me make it very clear that we will enforce to the regulations under the stay-at-home order. We don't, and we really can't look at things and say, well, that kind of activity, I guess we'll let it go. Other types of activity we'll enforce. When it comes to gathering with people outside of your household, whether it's indoors or outdoors, there will be very little latitude, if any, by our bylaw officers. It is very clear now that, and it has been for some time, that you are to maintain your relationships, whether you're indoors or outdoors, with those that you live with. Or if there is a single person who has joined your household to break that cycle of isolation, then absolutely that is allowed. But we are not traveling around saying, well, those activities, we'll let it be a break because those folks want to get together, or it's been a while since they've been able to do this activity or that activity. We are taking a very consistent tone with that. And we just ask people to do what's right. This is for a reason. This is so we stop transmission. And the easiest way for transmission to happen is for people to let their guard down, get into those social gatherings, whether they're indoors, very risky indoors, but outdoors, depending on what you're doing, it can be risky as well. So stay the course, Hamilton, doing a great job. We're seeing some great compliance around. So I want to both thank the community for that, but reinforce that we will be enforcing to that bylaw. Unfortunately, we still see some large gatherings that are being organized. We did have another protest this past weekend. Our Hamilton Police Services, working in conjunction with our bylaw officers, are normally aware of these things. They were this past weekend and dealing with them as best that they can. It's not possible for us to lay charges for every single person that attend these large protests, but we do target some charges, and in particular to those who appear to be the organizers of these events, to send a message about the need for us to all comply with this, regardless of what the reason for coming together is. So we're in this for a little while longer, at least until May the 20th. And we're going to continue to monitor, continue to do our good work, continue to focus our attention on what's really going to turn the curve. And that's the work in our vaccine rollout program. And that seems like a great point for me to stop talking and turn things over to Michelle to give you a bit of an update from public health.
Thanks, Paul. Good afternoon, everyone. Today we have 16,463 cases total in Hamilton, which is a change of 107 cases from yesterday. These include 971 local screening positive variant cases, 2,139 B117, which is the UK variant cases, 2 confirmed P1 Brazil variant cases, and 1 confirmed B1351, the South African variant cases. Locally, Hamilton is now currently sitting at just over 75% of our cases with a mutation or variant of concern when we look at our cases over the past 7 days. Of the 16,463 cases, 87% are resolved, meaning we have 1,501 active cases in Hamilton. Unfortunately, there have been 353 deaths to date, but today we are reporting no new deaths. We are currently reporting a total of 42 local outbreaks on our website. 2 of those are new outbreaks today, one at Copley Limited and another at Cable 14. Hamilton's 7-day moving average number of cases reported per day is at 155, with the weekly incidence per 100,000 at 181, with our weekly reproductive rate of 1.09. You can find more details about our local COVID-19 activity on our dashboard. With respect to vaccine rollout, as of today, we've administered 174,638 vaccines, and that doesn't include updated numbers from our local pharmacy efforts. We are experiencing a technical issue at the moment, which is preventing us from updating our overall number. We're working with the province to resolve this issue as quickly as possible. However, we are somewhere in the range of 30% of individuals in Hamilton have received a vaccine. On Friday, many of you would have seen that to increase vaccine accessibility to those who are disproportionately impacted by COVID-19, Hamilton Public Health Services prioritizing Black and other racialized populations and people of color, beginning with serving those that are age 18 plus and live in those priority postal codes, L9C, L8W, L8L, L8N, and L9K for COVID vaccine. While the vaccine supply is limited, it remains crucial that the limited supply is targeted to those most at risk to make the biggest possible impact overall. From social and demographic data collected by Hamilton Public Health Services, nearly half of all COVID-19 cases in Hamilton self-identify as a member of a racialized community, but racialized people in Hamilton make up less than a quarter of our total population at 19%. Hamilton Health Partners are working closely with Black and other racialized community leaders to determine how to best provide vaccine to community members across Hamilton. In partnership, we'll provide ongoing clinics in community-identified locations. We'll continue collaboration with our community groups and leaders and community health centers to support access to clinics. And we're launching a community ambassador program to build trust and confidence in the COVID-19 vaccination. This begins with the first mobile clinic operating this week at Restoration House and clinics for these community members at First Ontario Centre, Friday, April 30th to May 2nd. We're very encouraged by the community uptake of these pilot clinics. Appointments have been filled and we'll continue to provide more targeted clinics for our Black and racialized community members, and information will be shared shortly. When it comes to clinics for community members who have been disproportionately impacted by COVID-19 and our vaccine rollout more generally, I want to underscore how vital community partners have been to our efforts to deliver the vaccine to the community and in identifying clinic locations that are accessible and appropriate to the Black community and those racialized communities and people of color. Their efforts to help communicate the opportunities to become vaccinated have been critical as well, and we sincerely appreciate the support. As we work to provide vaccine to all community members, there continues to be attention needed when working with partners to ensure we are removing barriers wherever possible to reach those disproportionately impacted by COVID-19. The COVID-19 guidance for prioritization for phase 2 populations from the province continues to guide our collective work. Unfortunately, vaccine supply remains limited, and so we are working together to maximize the supply we have in order to reach our priority populations. Our goal continues to be administering vaccine to all residents of Hamilton, and in order to do this, we are moving as quickly as we can given the supply we have available. Despite the steady yet limited supply, we encourage all community members to be aware of all priority groups for vaccination so that they can be vaccinated whenever their criteria is eligible. We are hopeful that the vaccine supply will increase. Of course, those community members who are 40 years of age and over can also be vaccinated at pharmacies, and we would encourage you to visit COVID-19 Ontario vaccine locations on the COVID-19 website to find a location in Hamilton. To check if they are eligible for a vaccine based on other factors, individuals can visit hamilton.ca/COVID vaccines for more information. It is important to note that the appointment booking and the booking system used at local pharmacies is not run by the province or Hamilton Public Health Services. Eligible community members should reach out directly to participating pharmacies to register and book a vaccine appointment. The list of local pharmacies that are administering AstraZeneca can be found on the province's website, again, covid-19.ontario.ca/vaccine locations. The 3 large-scale vaccine clinics, First Ontario Centre, St. Joseph's West 5th Clinic, and Hamilton Health Science, continue to vaccinate eligible community members. To close out the vaccine rollout section of my remarks, I want to talk about a concern we've been experiencing within our COVID-19 hotline. Public health services staff have been increasingly faced with disrespectful and abusive behaviors from our callers. The city has a customer service standard, which we are proud to uphold. It's important to note that as part of the standard, abusive and harassing behavior of staff will not be tolerated. And those calls will be ended. We know many community members are feeling anxious, fatigued, and frankly quite frightened about the pandemic and are very keen to gain access to COVID-19 vaccines. However, we are asking for people to be kind, be respectful. People are doing their jobs and they're doing them under difficult circumstances. It's important for community members to be patient. The province determines how much vaccine is provided to Hamilton. How quickly our community moves through each phase is dependent on the amount of vaccine we receive. We know that everyone wants a vaccine and everyone will be offered a vaccine when they are eligible. Like many people in our community, our hotline staff have been working long hours since the beginning of the pandemic, often too balancing their own personal challenges at home with families, sick loved ones, remote learning with children, and etc. And they deserve to be treated with dignity in their workplace. Overall, COVID-19 case activity continues to increase locally. And as I mentioned earlier, the percentage of cases that have screened positive for variants is also growing, and local ICUs are facing critical challenges. As we've said in the past, it's important to look at the 7-day trends in cases and not the day-to-day fluctuations. It remains vital that community members, that includes any who are already vaccinated, that they stay vigilant and continue to follow the public health measures. This means staying at home as much as possible, getting tested for COVID-19 if you have symptoms or if you've been in close contact with a confirmed case, limit gatherings to only those members of your immediate household, maintain a physical distancing by keeping 2 meters or 6 feet from others who are outside of your immediate household, wear a mask or face covering when you're indoors or in a setting outdoors where you cannot physically distance, and wash your hands frequently. That's it for me today.
Okay, thank you, Michelle, and thank you, Paul, for quite a bit of information, and the reality that we're still in the middle of it, and people need to kind of adhere to all the recommendations that we're putting your way. And we know that it's hard and it's difficult, but you need to continue to do your part. And again, to reinforce what Michelle just said, there is no room for abusive behavior when you're interacting with our city staff that are doing their best to get everyone to where they need to be in the best way possible. So be respectful, be kind, be patient. If you want to be angry at the virus. This is the cause of all of this challenge, not the staff that you're interacting with or the people that are trying to help you get to the right place at the right time for whatever your need is, specifically around vaccinations. And yes, it can be frustrating, but clearly they're all trying to do their best and moving heaven and earth to try and make it as seamless and friendly and cordial as possible. So we need you to do the same. The vaccine is the best way that you can get a measure of protection in our community, ultimately over the long run. The only way that we're going to get to some sense of normalcy is to get a 75 or 80% vaccination rate in our community. So the most vital thing that you can do on behalf of your community, your family, your friends, your neighbors is to get vaccinated when you're eligible. So keep an eye on the eligibility requirements on the websites, and you'll be totally informed as to when you're eligible. And when you are, please do get the vaccine. And do remember that, you are the front line of defense, not the last line of defense. You are the first line of defense. So the actions that you take in our community, the adherence that you put into some of the restrictive measures that I know are difficult but necessary, that matters a lot in terms of who gets infected and who doesn't. And so please do your best to follow all of those recommendations. And I know the vast majority of people in our community are doing just that. So we thank you for that, and we encourage you to keep it up. And we encourage you to get vaccinated when you're eligible. On that note, I'm going to turn it over to Jasmine for any media questions. So Jasmine, over to you.
Great. Thank you very much, Mr. Mayor. We have 4 media joining us today. We'll start with 1 question and 1 follow-up for everybody. First question will be to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there. Thank you so much. My questions are for Michelle. So I was noticing a number of outbreaks in supportive housing facilities, and I was wondering if you can give us an update on how these outbreaks are occurring. As I know that previously public health staff at Kelly's Residence, for example, were working in multiple facilities at once. So I was wondering if you could shed some light on the sources of the other supportive housing outbreaks.
Thanks, Maria. With respect to congregate settings and supportive housing living situations and overall transmission, as you know, as noted, over 75% of the cases we have right now are a variant of concern. And so the transmissibility is key in that COVID spreads very easily person to person. I think that what we continue to see happening is people are very well intentioned and doing their very best to adhere to public health measures. And yet we are still seeing this transmission sometimes occurring in workplaces and locations such as housing situations where people are gathering, or not necessarily gathering, but they are in proximity to another person. And despite best efforts, there's still transmission occurring.
Okay, thank you very much. And I wanted to follow up on whether there's an update on vaccinations for these facilities. Are they currently being worked through as part of congregate care settings? And if so, can you tell me how many supportive housing facilities have received vaccinations out of how many in total in the city, as well as whether you have a timeline for when that should wrap up?
Yes. So right now we are in phase 2 with respect to the vaccine rollout and the provincial framework. Congregate living settings do sit squarely within that phase 2. And we are in a place right now that we are rolling out vaccine within congregate settings and will continue to do so. The supportive housing is a bit tricky in that we really do need to stick with those congregate living settings, and those settings being places where people have shared dining experience, that kind of thing. So in some cases, the supportive housing situation might meet that definition, while in others not. We would, though, encourage people who live in those settings as they become eligible for vaccine, whether it's through FSAs or age-based vaccine, to become vaccinated. But right now, our work continues to be focused on congregate living settings.
Great. Thank you, Michelle. Next question will be to Lisa Hefner from CHCH. Lisa, you can go ahead.
Hi, thanks very much. I think my question's also for Michelle. Looking at the growing number of workplace outbreaks in Hamilton, is there any talk or any indication that Hamilton might do similar to Toronto and Peel, implement shutting down any workplaces that have 5 or more cases?
Thanks for that question, Lisa. So in Hamilton, we're continuing to review the need to move forward with respect to how we address workplaces, considering what has happened in Peel and Toronto. Our medical officer of health, of course, is looking at that. We continue to support the province's stay-at-home order to break the chain of transmission where possible. And we are very concerned about the growing number of variant-related cases, particularly in those workplace settings. So we are working closely with workplaces as they have a case identified, just to understand where the transmission is happening in the workplace and how measures can be put in place to prevent ongoing transmission and growing numbers of cases. We aren't in a place yet locally in Hamilton where we have a clearly defined point at which workplaces would be closed, but certainly employers to date have been very cooperative and looking at ways to protect their staff and finding ways to put control measures in within those workplaces to date. We certainly wouldn't hesitate to initiate stronger measures, including in workplaces, to break the chain of transmission in our community to protect people if it's necessary. There's not one indicator we look at to make that decision, but really it is an overall look at the workplace, the type of work that's happening, where, if possible, additional individuals could work from home or work in different ways to break the transmission. But specifically at this point, we aren't in a place to make, the broad decision that Toronto and Peel did, but certainly looking at it more on a case-by-case basis.
Okay, thanks very much. My second question is back to your, you were talking about signing up for vaccines in pharmacies. Do you know whether any pharmacies still have vaccine, or are they waiting for a next shipment of supply and just putting people on a waiting list?
Thanks, Lisa. So at this point in time, Hamilton Public Health doesn't have information with respect to the supply in pharmacies. It very much is managed at the pharmacy level. We've certainly heard that local pharmacies are challenged with supply right now, not unlike us overall. But we would just encourage people to continue to reach out to their local pharmacies. Some are taking wait lists. We know about that. We also know that they are calling people up when appointments become available, whether they be through cancellations or others. So just encourage you to stay in touch with your local pharmacy.
Okay, thanks very much.
Thanks, Michelle. Next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope you had a good weekend. My question is for Michelle. Paul Johnson was just mentioning that it kind of looks like we've reached the peak of the third wave. Have we?
Thanks, Bobby. And to that point, so we certainly are in a place where we're seeing that our numbers perhaps are at that plateau point. I can't say that for sure, but certainly we are looking like potentially that's the case.
Okay. And in terms of vaccines, this question is also for you. In terms of vaccinations, last week there seemed to be a number of miscommunications. I'm hearing, and so are my colleagues from residents who are upset. They're hearing different things about when they can get vaccinations, where they can get vaccinations, and how is public health doing to fix up the communication, because they're describing it as a big mess.
Thanks, Bobby. I think overall, I would say with respect to the vaccine rollout, as we move into those phase 2 populations, it does become more complicated in that there are a number of groups who are prioritized for vaccine right now. So at the outset, when we started, we were very much targeting very specific groups. At the beginning of the year, our long-term care, retirement homes, and healthcare workers, as well as the 80 plus. It was a very clearly defined group. As we move into phase 2, where we have started work with our congregate care settings, as we noted, we're also working with our racialized communities, and then a number of groups who are at highest risk of poor outcomes with respect to COVID as a result of health conditions. They too are there. The other piece, Bobby, is that we're also doing a targeted approach within those specific priority neighborhoods where people are disproportionately impacted by COVID. And so I think because there are so many different groups within that phase 2 population, and just to remember too, that group in phase 2 really does make up almost 300,000 people within our Hamilton population. So there is some confusing, and I will say complicated messaging with respect to where to book and how. I think also complicating that at times is, as we just talked about, that pharmacies have their own booking system. And of course, our booking system is separate, some through the phone line and some online. I can tell you that we are in a place where 30% of our population has received a vaccine at this point in time, which I think is really great news for Hamilton. And there's all these bumps along the way. We're doing our best with respect to communicating clearly, and changes are happening very quickly. But we are doing our best to get vaccine out as quickly as possible and really learning along the way.
Thank you.
Thanks, Michelle. Next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much. I really appreciate the question and hope everyone had a nice weekend. My questions are for Michelle. Michelle, well, we're seeing other numbers start to go down. Percent positivity is still sitting at very high levels, record high levels in Hamilton. What is the significance of that? Like, what does that tell us about the pandemic, or what should we take from that?
So at this point in time, Joanna, with respect to percent positivity, you're right, it does continue to sit at high levels. It could be as a result of a couple of things. First of all, we do know that we still, of course, have high incidence of COVID-19 within our community. The other piece is that people who are symptomatic and truly potentially COVID-19 cases are those who are getting tested. So perhaps we're not testing as many people that are asymptomatic. The other piece is perhaps there are not other viruses circulating. So when people have mild symptoms, they are a COVID-19 case. So we do continue to encourage people that if you are symptomatic, absolutely go and get tested. That COVID-19 is certainly a possibility, even if you do have mild symptoms.
Thanks so much. And my next question is also for you. Do we have vaccine that was originally supposed to be for Hamilton being diverted to the GTA, to those spots where, they're seeing hospitals overwhelmed and really difficult situations?
At this point in time, we don't have that within Hamilton. We are continuing to receive our supply, and we haven't had our vaccine diverted elsewhere locally.
Great, thank you, Michelle. We'll go through for one more question for everybody. First question will be back to Maria from the Hamilton Spectator. Maria, you can go ahead.
Sorry. Hi. Thank you so much for the extra question. Going back to Michelle, I was just wondering if you can speak to specifically how many supportive housing facilities have fallen under that congregate care group, and how many of them have received their vaccines so far?
Hi, Maria. Thanks for that. I don't have the exact number for you with respect to how many supportive housing facilities fall under that group, nor do I have the full number of congregate settings. They're still really being identified. In many cases, we don't have a central inventory for this particular group of facilities. So if facilities feel that they are meeting that definition of congregate setting, absolutely reach out to us, because a lot of the work in identifying where these places are has really been self-reporting at the side of the agency or organization basically that owns the facility.
Great, thank you, Michelle. Our next question will be back to Lisa Hefner from CHCH. Lisa, you can go ahead. Oh, actually, it looks like we lost Lisa. We'll go next back to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you again. Yes, this question is for Mr. Johnson. I'm looking here at the COVID infractions page, and I'm seeing Kryptonian Inc. on, I guess, the 14th of April. Sorry, I'm a popular guy. My phone's going off. They were operating a business when they weren't supposed to be, and I'm seeing that on the 24th, 2 days ago, the same thing happened again. And while this list is not nearly as long as it used to be, how do you feel seeing businesses continue to break these rules? And is there a limit to which you say enough is enough and you've got to stop? You've got to close?
So absolutely, multiple infractions lead to other investigations, which can lead to other charges and other penalties. And you've seen this in the past with restaurants where their liquor license, for instance, has been withdrawn for a week or something like that in order to reinforce what's happening. In this case, I can't share all the details of the investigation, obviously, because it's ongoing. But not only multiple infractions, but a very public statement by this business that they are not going to close, that they feel they're just going to stay open. So rest assured that we are investigating this through bylaw. And if they feel additional actions are required in order to build compliance with the rules, then they will do so. To not undertake those investigations, to not take this very seriously, would send a message that just ignore it and put it down as a cost of doing business. That's not the case. Almost all of our businesses are painfully, and I say that word now because that's the kind of times we're in, they are painfully complying because this has such a huge impact on business. And so we will not let businesses simply say, we're going to stay open and keep coming by and giving us the garden variety charge. We will look at that very seriously, and you can rest assured our bylaw officers will complete their investigation as they see fit and lay potentially additional charges if they think that they're warranted.
Thank you.
Thanks, Paul. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. My question is for Paul. Paul, the head of Ontario's COVID-19 science table has said that he believes that it actually is safe to have the escarpment stairs open as long as people mask and don't congregate. They're just with their own household. Is there any thought to relooking at the escarpment stairs, or is there any chance of changes there?
So there's always the potential for change, and these decisions are done in conjunction with our Emergency Operations Center and with Dr. Richardson. And you said a very important piece in there, and that is they are safe if people are wearing masks. Our observations by the folks that maintain these stairs and by bylaw in general was that mask wearing was not at a level that we would find acceptable. And therefore, when you combine that with the sometimes crowded nature of these from a recreational perspective, thousands of people will use these at the height. The fact we are getting into warmer weather, which will draw more people out who may avoid them when it's a little bit colder. The decision was that we couldn't be assured that mask wearing was going to be at the level that we thought was important. Will we continue to look at the situation? Absolutely. But, you know, there are all sorts of ways that people can get recreation, to get exercise. This is just one element of it. And Dr. Richardson and the EOC will continue to look at it and see what changes need to take place. But the other side of it is, I know this has been a flashpoint in this community, but, you know, I have to say that, you know, some other things that are closed have far fewer people using them. And they remain closed. And so I think we need to look at outdoor amenities as a whole, where people get their exercise as a whole, and make some decisions. And that would involve the province being there as well, not just fixating on one local amenity. But do we continue to look at it? Absolutely.
Great, thanks, Paul. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you.
Okay, thank you, Jasmine, and thank you to the media for your questions, and to Bill Custers and the entire team at Cable 14 and Clear Cable for helping us put these media advisories together so successfully. And at some point, we hope to not have to do these anymore, but I'm not sure that we're there yet by any stretch. But it's been quite a long haul, actually, a year and a half of weekly updates on matters related to COVID. Certainly, it's something we would all like to put behind us. So in the meantime, we continue to provide as much information as we have available for individuals in our community to make informed decisions about what the best course of action is, and make recommendations on what they should do to avoid the spread of this virus. So please continue to adhere to those recommendations, and we'll continue to share our recommendations on a weekly basis and in between if necessary. So do your part, stay at home while you're under the stay-at-home order as much as possible. Connect with the loved ones virtually or on video chat or over the phone, and check with your neighbors. Make sure, especially the elderly neighbors who may not have family members close by, to make sure they're doing okay and have everything they need. And while you're still in the mood for shopping, try and shop local as much as possible. Curbside pickup is available just about everywhere. So visit the BIA webpage or hometowhub.ca to connect with and support our amazing business community that, as you may know, is struggling and certainly wanting to continue to work with you to make sure you get the products you want and desire and need to continue to function properly in our community. Always, for more information on COVID-19 and financial supports and any updates, visit the website at hamilton.ca/coronavirus. A lot of information there on everything you need to know about COVID-19, up to date as much as possible. So please use reliable information when you're looking to get information on vaccines. So go to the Hamilton website, go to the Province of Ontario website. Getting information on social media is probably not the best source for you to get accurate information on all of those matters. And we will continue to follow recommend all public health measures, and they do work. So do make sure that you put them into effect as much as possible so that we can all collectively stop the spread of this virus and get that vaccinations happening to allow us to get back to some sense of normalcy, hopefully in the very near future. In the meantime, we're going to see you next time on Monday, May the 3rd at 3 p.m. for our next media advisory. In the meantime, stay kind, stay safe, be patient, and look after one another. Thank you.